everybody. It's Dr. Mary Gardner, and I have a special guest friend with me today that I'm super excited about because not only is Dr. Michael Wong a friend, but he's also a fellow Gator. Yes. So go Gators. We both went to the same vet school. And I don't know if you know this, Dr. Wong, but my first day of vet school, I remember you had just graduated and you came in to like talk about being a vet or being a vet student and don't panic and all that stuff. So you were awesome. And I just remember that you coming in as you graduated. So Dr. Michael Wong, I have to ask you, I did not just bring you on because you're fun and you're a Gator. You are a specialist.
Yep.
And a veterinary neurologist. So can you tell me what that means?
Yeah, so just like in people where human doctors specialize in, oncology or cardiology or dermatology, veterinarians specialize in different disciplines. And the discipline that I specialize in is neurology. So basically problems that affect the nervous system, the brain, the spinal cord, the nerves, the muscles. So conditions we might see are things like seizures, like brain problems, difficulty walking in all four legs. So we'll see different problems in the spinal cord of the neck or in the back or in the nerves. So many times really dramatic stuff, sometimes really scary stuff, things that I think lots of people think and lots of veterinarians think is scary or sad, but it's what I'm really passionate about. And I've always liked that seizure is very dramatic. Okay, I can treat the seizure and the dog looks better, and it's a very dramatic turnaround. That dog that's paralyzed, looks scary, looks like we're no hope, and we can provide that hope and that fix, and that dog gets better. So those are the things that really interest me.
So for the Grey's Anatomy fans out there, you're basically McDreamy of the vet space.
I don't know.
I think yes. So I remember neurology used to kind of scare me a little bit because it's the big deal. It's the brain, and you guys are removing tumors from brains and radiation and discs and just going in surgery on the spinal cord. Like it's awesome, and hats off. And so you founded Southeast Veterinary Neurology 7. Which I have here, and that is here in South Florida. And you guys have, I would welcome everybody who's watching to go follow your social media, because you put these videos that I've told you you're my favorite group to watch the videos, because they're awesome to see the before and after of dogs with like all four legs are dragging, and then you're like 3 weeks later and they're walking, which is miraculous. So okay, so Dr. Sheila Robertson had to say here, what an excellent choice for
Dr.
neurology.
Robertson.
I love it. Awesome. Okay, so I've got a list of topics that throughout the year I'm going to try to drag you on to talk about, like seizures, like vestibular problems. And I love the things that happen to old dogs and cats. So everybody's saying hi to you, so excuse me as I look. But I wanted to focus today on something I see a lot, which is degenerative myelopathy. So I'll put it there because it's a mouthful for some people, and it is something that I know that your team and you see a lot of when people come to you. So can you explain what is degenerative myelopathy?
Yeah. So myelopathy just means a problem in the spinal cord. So it's a fancy way of saying spinal cord problem. And degenerative is just like you assume it's a degeneration. So there's a degeneration of the spinal cord. The spinal cord's job is to carry the information from the brain, down the neck, down the back to the back legs and the tail and the pooper and the peer, and then the information back up from there up to the brain. So the brain's saying, walk, and the legs are saying, here's where I am in space, and the brain is sort of sensing that. So degenerative myelopathy typically happens in the spinal cord of the back. And so we classically see rear limb weakness and incoordination, because that connection from the the back legs to the head saying where I am in space, there's a problem in the spinal cord or in that information, and the brain saying to the legs, be strong. So we see weakness and incoordination in the back legs.
What about the tail?
So usually, the big thing that we're seeing is the back legs. Yeah. Eventually, what happens with it, and don't want to jump ahead. I'm not sure exactly what you're going to ask, but this is we're
go crazy.
We're going to make this whatever we make it. So usually, tail paralysis or stuff like that isn't something that we classically see as a problem. Eventually, dogs can become urinary or fecal incontinent as it progresses. But really, rear limb weakness and incoordination is kind of the primary thing that we see.
Is the first thing. So if you, so the weakness, and that could be, a lot of people consider that, oh, this is just him getting old and he's getting tired, or maybe it's arthritis or some other problems, right? And so is it normally both sides or one side? So will you see limping or will you see just like weakness?
Yeah, so I guess there are a couple other things that we take into account when we're trying to say, is this degenerative myelopathy or not? I mean, because lots of other things can affect the spinal cord, or lots of other things can cause dogs to be weak. So things that we're expecting with a dog with degenerative myelopathy, we see it in certain breeds. It's a genetic condition, so we see it in certain breeds of dogs. The German Shepherd's kind of the classic breed, but we'll see it in Chesapeake Bay Retrievers, we'll see it in Boxers, we'll see it in Corgis, and it usually comes on slowly. So it's not this sudden, I go from I'm a running dog to I'm dragging my back legs. It's usually kind of this slow over months, that the owners notice, well, gosh, my dog just isn't as strong, isn't as coordinated as he or she used to be. Usually they're older dogs, kind of 9, 10 years old is when symptoms are first noted. And it's usually not painful. So that's kind of many of the things that we're looking for to say, well, gosh, is this a neurological problem or not? And is this neurological problem consistent with degenerative myelopathy or something else? So like you said, arthritis can cause difficulty walking, often affects older large breed dogs. And, sometimes we might, we're presented with a dog. Well, is this because of an orthopedic problem? Is this because of arthritis? Or is this because of a spinal cord problem? And that's kind of one of our primary jobs, is saying, does this look more like a neuro problem or an ortho problem? Sometimes we have both. Quite frankly, oftentimes we have both. But one of the things that we see that makes us much more suspicious of a neurological problem is kind of dragging of the toes. So dogs that have arthritis, dogs that have bad knees, sometimes we'll see more of a lameness where they don't want to put weight on the leg, or they're slow to get up. They're worse after resting. If they've been laying in their bed for a long time, they have a hard time getting up. Whereas degenerative myelopathy, a pure spinal cord problem, we're not necessarily worse after laying down, but instead of seeing difficulty putting weight or bearing weight, we're seeing more incoordination, like we're starting to scuff our toes. Sometimes as it advances, we see maybe crisscrossing of the back legs. So that's thing number one that we're trying to sort out is this a neurological problem or an orthopedic problem? And sometimes it's both.
Yeah. Now, the other neuro problem I see a lot, which I did a different Facebook Live on, is degenerative or geriatric onset laryngeal paralysis and polyneuropathy, a big word, gulp. So I could see where that gets confused too, because it's very similar in the hind end.
Yeah. So that's, I'd say less common for seeing them as difficulty walking. But yes, I mean, they're both degenerative conditions. We see both of those classically in larger old breed dog. Wow. Older large breed dogs. So there's
I
plenty.
swear, everyone, he is boarded and smart.
Exactly, but book smart, as my wife likes to tell me. But so older, large breed dogs. So we similar population of dogs. That's again another thing that we tell on our examination. So a dog with degenerative myelopathy, what we expect to see is they're usually able to walk when we first meet them. The front legs seem pretty strong, but the back legs are kind of crisscrossing or scuffing. The owner doesn't describe any pain. It kind of came on slowly and it's slowly getting worse. But when we do our neurological examination, their reflexes are still normal. So we'll tap on their knees. I'm pretending like this is my knee or this is a dog's knee. If we tap there's still that knee jerk reflex. When we pinch on the toes of the rear limbs, usually they'll still pull them back. Same thing in the front legs. Usually their bark is still nice and strong. So as opposed to the polyneuropathy and laryngeal paralysis type dogs, many times the first thing that owners notice is, yes, the rear limbs are weak, but they walk a little different. That many times the front legs are a little clumsy as well, not quite as obvious as the back legs. The history is usually similar. Hey, it's kind of come on slowly and, getting worse, but it's our examination. Usually those dogs with the polyneuropathies, they've got a bark change or they're kind of breathing funny, or when we pinch on their toes or tap on their knees, they don't have normal reflexes. So, but that's certainly one of the first things we're trying to tell when we meet a dog. Is it neurological or orthopedic? Assuming it's neurological, is it affecting the spinal cord, the brain, or the nerves and muscles, where polyneuropathy is nerves and muscles, where degenerative myelopathy is spinal cord.
The spine. Now, is there a test that you guys can take to see if the dog has a gene?
So you did this, and it was a very leading question with answering, does it have a gene? So we may have skipped or glossed over that it is a genetic problem. Even when Dr. Mary and I were in school, we didn't know that it was we had not identified the gene at that point. So, but before us, is it nutritional? Is it environmental? Things like that. And back when we were in school, they were just starting to do things like MRIs. They were still doing myelograms and, if they were lucky, a CAT scan. So the way I approach diagnosing a dog with degenerative myelopathy right now, to me, the first thing is the signalment and history. If this is a 1-year-old dog, or it came on suddenly, or the dog's really, really painful, even if it's a 9-year-old German Shepherd that's really painful or came on suddenly, that's not really sounding like degenerative myelopathy to me. So the first thing is it an appropriate age, breed, the story we're hearing from the owner, of when it came on, did it come on slowly? Is it progressing? To me, that's sort of piece of the puzzle number one with regards to coming to a diagnosis of degenerative myelopathy. Piece of the puzzle number two is just my examination. Just like we kind of talked about with that polyneuropathy thing, the signalment and history can sound pretty darn similar between those two, but it's my exam that says, yes, this is a spinal cord problem. Yeah, the dog doesn't seem painful. Yeah, it seems like it's a mid-back spinal cord problem, because that's classically where degenerative myelopathy starts, is in the mid-back, and our symptoms are just rear limb weakness with normal front limbs, what we call thoracic limbs. So puzzle piece number two in getting that diagnosis to me is my examination. From there, yes, there are tests, because even if I've got a 10-year-old German Shepherd, non-painful, slowly progressive rear limb weakness, there are other...
It sounds like you're checking the boxes there, the DM boxes.
Yep. So it sounds just like DM from my signalment and history, from my examination. There are still other neurological conditions that can look the exact same. So 10-year-old German Shepherds can get tumors of their spinal cord. They can get slipped discs. We classically think of a slipped disc as coming on suddenly and being painful, but not always. So we can see stoic dogs, or dogs that, the disc is, more slowly compressive. We can see malformations, so fluid pockets on the outside of the spinal cord that can cause the exact same symptoms. So tests are usually warranted in order to give a definitive diagnosis. So we recommend MRIs here. There are different ways. You can start off with plain X-rays. That's a good way for screening for like broken bones, tumors of bone, infection of bone. But usually those things are all painful, and isn't enough to show you the spinal cord so that you can say, yes, this is degenerative myelopathy. So an MRI gives us a picture of the spinal cord, and we can see, is there a tumor? Is there a malformation, a fluid pocket, a cyst? And are there disc bulges that are significant enough to be causing the symptoms? I personally don't do a lot of spinal taps for dogs that I'm strongly suspicious of degenerative myelopathy based off of, all those puzzle pieces. And if I get a normal MRI or an MRI that has just a mild disc bulge, I often won't do a spinal tap. Many neurologists will. So I don't think there's a right or wrong there. To me, that's just another data point of ruling things out.
And just ruling like out infection or fungus or, something like that, right? So.
Yep.
Now, I'll say, so my girl Sam, I had an Anatolian Shepherd, which many people like, I talked about her like last year a lot. So she had what I was considering definitely DM. So the weakness, just when she's in front of her food bowl, would start to like sink a little bit, and then get back up and scuffing the toes. It was slow. And I'm like, Dr. Wong, my girl's got DM. So I brought her to you guys. And so Dr. Serta at your place, who was my classmate, was the neurologist that took care of her. And her little feet flip in. And so I did the MRI, and it's very important to do because I was 1,000% she's got DM. And I'm a vet. But you're a dog or cat mom first, or dad. Totally. So you go a little crazy. So I was a little crazy, and you guys treated me very well there. So thank you, Seven. But she ended up having spinal lymphoma. So she had cancer in her spinal cord. Like, we would not have ever known that unless we did the MRI. So that treatment, totally different.
Totally.
And so it was really important.
Yeah. And then fantastic point. And then the last piece of that puzzle is this genetic test.
Yes.
So in 2009, 2010-ish, researchers in Missouri found the mutation in it's called a SOD1 gene that if you have two bad copies of it, it's very strongly associated with developing degenerative myelopathy. So it's a fantastic piece of the puzzle, kind of what I'm often telling veterinarians and telling pet parents, is by itself, it's not enough to give us an answer. So, the question becomes, well, gosh, can't I just do this test and it will tell me, does my dog have DM or not? Basically what it's telling us is, does my dog have two bad copies of it? So we're at risk of developing degenerative myelopathy, and, it needs to be strongly on our worry list if all of these other things that we said are true. Do I have zero bad copies or two normal copies, which in that case, it's incredibly unlikely that it's degenerative myelopathy. And then do we have one good and one bad, where those dogs, there are reports of dogs with one good, one bad still developing degenerative myelopathy and being diagnosed at autopsy or necropsy. But they also use that just for breeding purposes, in that, we're
that's what I was going to say. It's good for breeding. And maybe if somebody does want to have a certain breed dog, they should ask that the parents have gotten tested.
Yeah. I mean, they have to be careful for all genetic things, is, do we use that as we only breed, these dogs as opposed to these or these, because there are other, characteristics that might be accidentally, bred out or bred in, making those decisions. So it needs to be part of the decision. So to me, that's how I diagnose degenerative myelopathy. I've got appropriate age, breed, signalment history. I've got appropriate clinical signs. I've ruled out other things with an MRI plus or minus spinal tap, and I get the genetic test. And when I've got all of those, the puzzle piece comes together, because the only way you can truly diagnose it is histopathologically. So it's not easy for us to, in a live dog, sample the spinal cord and look at it under a microscope. So the way that we diagnose it in a live dog is just how I said.
Right. So for those of you that histopathology means basically taking a piece of the spinal cord, looking under a microscope, that's after the pet has passed. So it's definitely something that we can't do before. Or now, to your point about why don't we just do the test and not do the MRI, or do, my girl Sam could have had the gene for it, but it's not, that's not her problem. Her problem was the cancer in her spine. And I elected to do chemo and radiation, which we would never have known about if we just said, oh, she's got the genes, that must be what it is. Or she got some painful thing like a disc that we wanted you could do surgery on.
Yep.
So that's very important.
Yeah, and when we meet pet parents, we kind of just, our job is to discuss, here's the rationale for that, and the downsides of MRIs and the costs. And we totally understand that, not every family can do
True.
that. So is it still reasonable, to do a consult, do x-rays, do a DM screen? Is that more information? Is that more pieces of the puzzle than had we not done them? Absolutely. But usually it's not enough to completely rule out. So like you said, you could have a 10-year-old German Shepherd with appropriate signs and a positive DM, but it's got a tumor, it's got a disc, it's got all the things that you said.
I think it is very important to know that not every clinic has an MRI nearby. Not everybody can afford it because it's not cheap. And it's also, we don't, just because we can doesn't mean we have to. I think I'm on the side of our veterinarians where some people will say, well, my vet didn't diagnose it correctly. Well, sometimes we're only working with a few tests, and, be kind, because that's what we've got. No judgment either which way. So I didn't have to do the MRI. I needed to know. The other thing to which people get scared about, especially in older dogs, and I did a Facebook Live with Dr. Sheila on this like a year ago, is anesthesia and MRIs. Dogs don't just sit still, do they?
Yeah. So great point. We need to do anesthesia for an MRI of the back. MRIs take longer than X-rays. It's like a snapshot, very, very quick. We don't necessarily need to be anesthetized, whereas for an MRI, dog needs to hold still for an extended period of time, 50 minutes, hour and a half, somewhere in there, to, depending on the size of the dog and how much we're looking at. There's a risk of anesthesia, and those are the things that we talk about with clients. From an anesthetic standpoint, and Dr. Sheila is going to
I know.
So that was the amount of knowledge that I have compared to her. Just in case
I know
anybody was wondering what I was doing with my pinky there. So we always talk about anesthetic risks with clients, and whenever we're making a recommendation, we're kind of weighing those pros and cons, the likelihood of it giving us information that either lets us help that dog or lets us know what we're dealing with, versus the risks of anesthesia versus the costs. So, that's something that all veterinarians are always taking into account. And when we're making the recommendation for a test, whether it requires anesthesia, whether it's blood work, whether it's x-rays, we're making that recommendation in that we think the likelihood of us helping your pet, outweighs the downsides of it. Anesthesia, back when we used to do myelograms, I felt that dogs with DM would get transiently worse after a myelogram. Some people, wondered, was that the anesthesia? For me, it was more the myelogram because, nowadays we're doing MRIs that are longer. They require more anesthesia than a myelogram or a CT myelogram. But I don't see those dogs wake up worse, whereas dogs, when we were doing myelograms, would.
I see. Yeah. Now, quick question before I get to my big question is, do cats get this?
To my knowledge, cats do not get degenerative myelopathy.
I didn't think so, but I thought I got a neurologist. Let me ask a good question.
If you've got a cat that's slowly getting weaker in its, in its rear limbs, there are lots of other things that we're thinking of. Lymphoma,
Yeah, that would be my top one there too.
Those would be kind of the two main things that would be.
So I know there's no cure to this, which is really sad. And I know you were a little bit worried coming on here, like, I don't have good news, Mary. So it sucks because there is no cure for this, but we can manage it.
Yep. Yeah. So
how long though? So from it's so hard to say how long do they have, because they could have had symptoms for a year before their diagnosis, or so of course when you catch it, but on average, how will a pet die from this? Let's go straight to the core. How will they die from this?
The likelihood is that they're going to be euthanized because of it. So most dogs, the bigger dogs, I'm meeting when symptoms have been going on for 5 or 6 months. That's just kind of the classic time where owners come in. From the time of that diagnosis, kind of the next thing that happens is they become weaker and weaker and weaker, and eventually they get weak enough that they can't walk. And average for that, and again, it's an average, is about 11, 12 months. And some pet parents, will say, hey, at the point of diagnosis, that's the time to stop. Some owners say, well, when my 11-year-old, shepherd now can no longer walk, that's the time that I'm going to stop. Some people will put their dogs in wheelchairs, and they'll keep going. After that, one of the things that happens is they become urinary and or fecal incontinent, and that's kind of the next time. It's a huge management issue. It's one thing if you've got a Chihuahua that's having poop and pee accidents, but a 80-pound dog with poop and pee accidents is a whole other animal. So that's kind of where we lose sort of our next subset of pets. Where owners just say, okay, it's not getting better. It's not going to get better. She can't walk now, and now she's pooping on herself. Whether it's the dignity aspect or the management aspect, that's kind of where we lose the next subset. If a pet is not euthanized, eventually they're going to start showing weakness in the front legs. And eventually they're going to start showing what we call cranial nerve signs. So problems of the nerves, for swallowing and for nerves around the face. So
what about breathing? So
if nothing was done, eventually, yes, the dog would have a difficult time breathing, and it would be
I just like to bring this up because there are some people who, want Mother Nature and don't want euthanasia, and I think it's good to set expectations of what the next step is. And in those cases, I'm going to strongly recommend definitely getting hospice care, because I don't, and not that hospice means we don't euthanize, but I want to make sure that the pet has, palliative care.
Yeah. So I guess the silver lining of this disease, now that we've said all the terrible.
I know there's a silver lining.
Silver lining is that it's not painful.
True.
So tumors of bone, broken bones, slip discs. Let's stay on like tumor of bone. If we do nothing, that dog's going to be really, really painful, and that's why those dogs tend to get euthanized sooner than dogs with degenerative myelopathy, because they're not painful.
Right.
So to me, that's the silver lining. Unfortunately, there's nothing that I can do to stop this condition, But the silver lining is, I guess the next silver lining is it takes months, so it's not something like, a week from now your pet's going to be gone.
Correct.
So it's not
you can have time to prepare, which is what I'm always big on, is bucket lists. And I had a dog, Duke, on a couple of weeks ago with his mom, and we were talking about his bucket list because he had DM, drove across the country with him and did all these fun things. So it does allow us time. I do think, though, that some dogs may become a little anxious when they can't get up and they, can't do their normal activities. And I do believe anxiety is a form of pain. So there are some dogs that are like, whatever. My girl Sam, she's like, no problem. I got this. I can't walk and I'm pooping all over your house, Mom, but no problem. And we do see, though, an increase of urinary tract infections when they start having, either fecal incontinence because it's, traveling up there and things like that. So what about management?
Yep. So kind of standard big dog management, whether we're talking about slip discs or, tumors or just any reason a dog can't walk, to me, nice, soft padded bed. So we don't want big dogs laying on hard surfaces or carpet for extended period of time. I totally get it. In South Florida, we can provide the nicest bed ever, and that dog's going to want to get on the cool tile. But what we're trying to avoid is bed sores or pressure sores. Slings or harnesses to help get that dog up. There are very, very fancy ones now that, are fantastic. They're nice and padded. They kind of, go around the hips as opposed to just around the chest. So it really helps with that management. Wheelchairs, can give mobility, that quality of life. That dog can still chase the ball, chase squirrels, go out on walks, things like that.
And not everybody's, open to that. And there's opinions on, well, is that, ethically okay? And we're not getting into that. I have seen some dogs live amazing lives in wheelchairs, 100%. And I've also seen my girl Sam basically give me the middle digit when I tried to put her in a wheelchair. She's like, nuh-uh, you're going to be carrying me around. So I think the pet's personality and what they do. And listen, I got to give a shout out because I get no money on this, but the Help 'em Up harness, everybody knows it's my favorite harness of all time. And is so helpful. Help 'em Up harness.
Yeah, I didn't know what we were.
What we're allowed to say. No, and there's great wheelchair companies and I don't even I'm looking at my girl's wheelchair. It's here because she didn't want it, but I've got a $500 wheelchair right here, so I can't get rid of it yet.
Many times, sort of, to provide traction when that dog's still ambulatory but slipping out. There are different products to provide traction on the bottom of the surface of the pads. Booties, things like that, and there are very, very individual. So some dogs, my dog, when he was older, we tried putting on those booties and he was like, no way. He just, was doing this.
Donkey kicks. Yeah,
exactly. But
and sometimes I found with Sam, I went through all the booties. And I'm booty queen because I was going through them all. I know my friend Leanne is like, Mary, that wasn't good, booty queen. But some of I love rough wear booties and things like that. But then they all became very heavy. And she was dragging and scuffing her feet. So then I went to the balloons, and there was so many different options. So I think you just got to try them. And I see a lot of people are posting their stuff in here.
Wow, look at that.
I know, and I talk a lot about mobility management in my book because I've tried all these products, and it's sometimes you just got to try them all to see what's best for your environment. Like you said, we're here in Florida. There's people in the snow. It's so different. The weight of the pet, if you have a corgi, that's a very different world than if you've got a German Shepherd or, my girl was 80 pounds. Now, I love me some physical therapy.
Yep.
So is Rehab Good?
Rehab is basically what our recommendation is when we diagnose a dog with this condition. So we have the conversation, we set the expectations of, hey, there's nothing we can do to cure this. This is sort of the expected decline, here are the things to be looking for. But what would we recommend? What do we do what would we do if it were our pet? 100% we recommend physical therapy. There is a study that kind of compared dogs with DM or suspected DM that got rehab versus those that didn't, and there was a difference in the survival. It's not a perfect study, but
I think I saw that in LARPAR as well. Same thing. Like it was survival time was better just because you're all that stuff is so good.
Yeah, I mean, for me, if all that the rehab is doing, it's not doing anything to slow the degeneration of the spinal cord, but if all it's doing is maintaining muscle strength, right. Joint flexibility, things like that. If all it's doing is helping all of the other things that 10-year-old large breed dogs get, their arthritis, 100% supportive of it. So yeah, every single one of our dogs that we diagnose with rehab goes home with here's rehab you can be doing at home, but here's referral to someone that's rehab professionally.
And that's where I think there's a lot we can do at home. So it's not like you have to go all the time to rehab. And I did drop my girl off twice a week to rehab because I needed the break. And for those of you out there, like, this is tough. And even though she didn't have the same disease, it was like a DM dog. So I needed to have her somewhere else and somebody taking care of her, but I still did my own PT at home. Somebody asked about the Assisi loop. Now, do you know about that?
I know about it. I don't know enough to give.
I don't think it helps. What they say, I don't think they've done any research on it for helping this.
I know it's been looked at for dogs with slip discs. I'm not sure about for degenerative myelopathy. I have zero personal experience. Yeah. So to comment.
Yeah. What about laser therapy?
So we do laser therapy specifically for our dogs with, slip discs as part of their postoperative pain management status. Postoperative pain management protocol. I guess with regards to degenerative myelopathy, again, no studies, no proof to suggest that it's going to help the spinal cord change the dog's genes or stop the degeneration of the spinal cord. Is there a place for it, with treating arthritis, for that same rationale of physical therapy, absolutely. But to me, it's all about, letting the owner know what to expect. What do we expect this to do? What will it help? What might it help? What's the likelihood of it hurting? What are the costs? And just help them make that decision.
Okay, I'm going to hit some of these questions because we got to hit a couple of these. So I've got Robin with her 17-year-old pug.
Okay, you're speaking to me. I'm a pug guy, so
I know, that's why I had to say this. Stands like a sawhorse with all four legs wide apart and stoops low. Is this part of DM?
So I guess I'll blanketly say this now before if there are questions.
Yeah, wait, you even said to me, don't ask personal questions, but this is just, I like the sawhorse.
No. I'm fine with personal questions. I'm afraid that I might give you too much of a personal answer, and so it's challenging for me, having never seen your dog, and medically inappropriate for me to, say too much, diagnose, treat, prescribe, etc. So
okay, we got the
disclaimer out there. Yes. Do pugs get degenerative myelopathy? Years ago, so yes, I think they get DM. I think many dogs that years ago were diagnosed with degenerative myelopathy probably actually have a different condition that, over the last 5-8 years, now that we're doing MRIs more, we're recognizing more, that can cause slowly progressive, non-painful rear limb weakness. And in pugs, that's, a constrictive myelopathy or subarachnoid diverticulum. There are different names that we use for that. So I guess when I hear older pug with rear limb weakness that's non-painful, that's progressive, plus or minus urinary or fecal incontinence, I'm thinking that condition. So pug myelopathy, constrictive myelopathy, facet hypoplasia. Those are kind of the names that different neurologists use.
We're throwing out some hot terms now.
Describe that.
You're McDreamy now. You're throwing out these big words.
Sorry, so there are other conditions that I think
is on your list for this girl.
That are on my list for this. Yes,
okay.
I apologize. I tend to say the same thing 5 different ways. And
quick question on if a dog is negative for the gene, could they still have it?
My understanding is there are documented. So after the pet has passed away and they did the autopsy, it's exceedingly rare. So if I had done that test on my dog and I had, 2 good copies, I would absolutely be looking for something else as the cause. But my understanding is I believe that they've, even despite having 2 good copies, there are isolated, documented times.
Loss of appetite?
Typically not as one of the first or common things. It's not one of the things I associate with degenerative myelopathy. Sure, the complications of being a big dog that's non-ambulatory, do those dogs get pneumonia? Sure. Do they get urinary tract infections? That could cause appetite to go? Sure. But a typical symptom of DM, no, it's not one of the things that I think about. Makes me worry more systemic stuff, whether it's problems, kidney disease, liver disease, or whether it's a different neurological disease that's causing the rear limb weakness, like cancer, like infections, stuff like that.
Like my girl Sam. They will all eventually lose urinary and fecal control.
You're saying dogs with DM?
Yeah.
If
kept
left
that
to natural nature take its course, they will typically become urinary or fecal incontinent.
I'm trying to bang through some of these. Let's see. I love, somebody said their dog didn't love the wheelchair, but they loved a stroller. And that's, sometimes has to happen. Let's see. Oh boy. A lot of people are liking some stuff. Since DM isn't painful, is it silly just to, somebody's giving them NSAIDs and gabapentin? They could also have arthritis. So that's important. And we said that earlier, like they could have other things. So if it's been diagnosed with arthritis, but if it's just DM.
Yeah. So NSAIDs, gabapentin, tramadol, whatever it is, isn't going to help DM. Correct. Is that sometimes part of our treatment regimen? Absolutely. But we're more using that for kind of the other conditions that older large breed dogs get, but under the recommendation of your veterinarian.
And the gene test is a blood test.
Yeah, so there are actually 2 ways of doing the test. So you can actually order an at-home cheek swab, very, very simple. You go to the OFA website, you can order it, you put in your address, your credit card, they send you the swab, and then you send it in. And that's useful for, your particular dog. The way we do it at our office is we will send in whole blood. And my understanding is that's more beneficial to the lab. They're able to bank it. They're able to, use for future studies. I don't believe that there's a difference in the accuracy. So I think both are, completely valid tests. We do whole blood because that's what the lab has at least told me that they prefer.
That they like better. Nice. Okay. So listen, I know you got to get back to work. You got spinal cords to fix, brain.
I have to go pick up my son. So I'm
real life.
I'm good.
I was scrolling through, so most we've kind of covered, and I'll answer some of these offline as well, because I don't want to take up all your time. And this has been so helpful. It's such a frustrating disease because there is no cure, and it's hard, especially these bigger guys. I know it's hard to manage them. And now you are located in South Florida. So I know you have right near me in Jupiter, Palm Beach County, we got one of your clinics, but you're in Miami and Boynton Beach. And drum roll.
Drum roll. We're opening a location in Virginia Beach, Virginia in August of this year. So yes, we're branching out.
Branching out. I love it. This is great. So we're not just, Florida based anymore, which is everybody's saying thank you so much for your help. So this was awesome. And yes, thank you. Thank you for all that you do. Thank you for taking my girl, Sam, everybody at 7 was so wonderful. And this was a long one, but I think a really important one. And thank you so much for your time. And like I said, people, I'll answer comments throughout the next, hour or so. And Leia says, come to California. And if your veterinarian does recommend seeing a neurologist, they'll usually be able to tell you one's nearby. And sometimes they are hours away, though. So that's you're few and far between. How many neurologists in the country?
The number they throw out is like 350. I honestly don't know. It's probably more than that.
It's not a lot. That's
not enough. So
not enough. Listen, I ain't going back to school though, so you can't have me.
I'll hire you.
That you'll hire me. That's way too much studying. All right, everybody. Thanks so much. Thanks so much, Dr. Wong. I really appreciate it. Take care,
I enjoyed it. It was fun seeing you, and I appreciate all you've done for me over the years. So
you're very welcome. Thank you, everybody. Bye.